They call me fat all the time. It hurts for me to walk sometimes, and I get made fun of a lot. Children are not only physically but socially and psychologically affected by obesity. What can nurses do to make this stop? Childhood obesity is a growing problem in the United States. According to the CDC, childhood obesity has more than doubled in children and quadrupled in adolescents in the past 30 years. This leads to unnecessary health problems that can be controlled with proper nutrition and exercise. Children are at increased risk for immediate joint and bone problems, sleep apnea, social and psychological stress, bullying, and low self-esteem. As we all know, prevention is key, so why not target the children where they spend most of their time? In the schools. Schools are required to meet the dietary guidelines for Americans and provide minimum calorie levels, 1/3 of the recommended dietary allowances of protein, vitamin A, vitamin C, and calcium. It is evident that children are shapers of and shaped by the world around them. When a child is not healthy and has poor nutrition, how will it affect their full potential as a student, future consumer, employee, parent, etc.? Nutrition is key for a healthy child. It increases cognitive function, physical, and an overall of self-confidence. How do we as nurses advocate for proper nutrition and health? So how can nurses change the healing environment in schools? It's easy. Change the environment that's offering poor nutrition to children. Educate parents and prevent childhood obesity by educating children in fun and creative ways. Sustainable development aims to support the development of the whole child by promoting their emotional, social, physical, and cognitive development, all with proper nutrition. According to UNICEF.org, societies can develop in a sustainable manner if the basic needs and rights of children are met. Evidence shows that investing in children yields high and long-lasting returns, not only for individuals and families, but for entire societies and generations.
Many nurses consider involvement in policy as an extension of their roles, both in speaking for those who may not be able to speak for themselves. Since many factors contribute to childhood obesity, policy may be one of the most powerful tools for advocating change in conditions that contribute to obesity. One barrier to health equity is that budget cuts are removing the role of the school nurse and physical education. In addition, parental knowledge and involvement may be a barrier to proper nutrition. Studies show that children tend to eat food easily accessible to them and eat more when large portions are given. The American Academy of Pediatrics has suggested the provision of parent education on diet to prevent obesity. Environmental influences serve as barriers to health equity, as families that live far from grocery stores do not consume many fruits and vegetables. There are many advanced health policies that support health equity. One is to advocate that the federal government increase physical activity. Also, engaging families in prevention activities and encouraging parenting styles and models that promote healthy eating and lifestyle. Nurses can partner with parents to develop a plan of action. Schools can increase the number of students that walk and bike to school and make more fruits and vegetables available at school. Nurses are an important role in helping children develop a healthy habit of eating and living healthy.
School nurses have the ability to be so much more than an excuse for a student who didn't study to skip a test. School School nurses have the ability to impact and change the lives of their students. Prevention is more effective than most corrective approaches once obesity is established. By the time the children enter kindergarten, their food preferences and their social context associated with food intake are established. Nurses can start teaching preschoolers creative ways to eat healthy by making food fun, creating shapes with food, sharing a vegetable that day, making a name that fruit game. Growing gardens in the schools will help engage the students in learning about nutrition and living sustainably. It allows students to make a deeper connection with the food that is actually going into their bodies. By making stations where food is actually served as a hurried place on disposable utensils, we are teaching students that the eating environment is supposed to be fast-paced and not enjoyable. Instead, we need to create a healing environment where students can sit down, engage in conversation with their classmates, and this will set a more relaxed tone and a more relaxed setting. Vending machines are another opportunity for students to make healthier decisions. For example, instead of chips and soda, there can be teas, wraps, juices, something that's going to be more healthy but still quick for them to get and still be cool with their friends. By creating signs that display information on food portions, this can help the students visualize what should be on their plate and how to measure it out. For example, for proteins, you're going to do the palm of their hand. And these can be signs that we can have displayed throughout the school, especially in the cafeteria. Plain and simple, healthier meals equal healthier lives. Nutrition in children can help create a healing environment by instilling positivity, energy, and a sharp mind to tackle any obstacles a child may have in all aspects of their lives. Healing comes from within. Let's feed our children appropriately.